introduce Stephanie Kight, who is the president and CEO of Planned Parenthood Advocates of Ohio, to talk about the issues that we're facing and to lead us through the charge of the day. Stephanie?
Thank you. Thank you so much for joining us today. Over the past 2 years, we have witnessed the most aggressive legislative attacks on women's health and rights in a generation. But in last week's election, voters across the country and here in Ohio spoke out and voted to protect a woman's ability to make her own personal, private medical decisions without interference from politicians. We sent a clear, powerful, and unmistakable message last week that women don't want politicians to meddle in their personal medical decisions. It's clear some Ohio politicians didn't hear us last week, so we want to make sure that they can hear us now. Thank you, Senator Nina Turner, for giving us time today and space to speak out and remind decision makers here that voters want to protect women's health care. They don't want to restrict it. To be fair, there was a brief moment in time when the message voters sent last week seemed to be heard. Last week at the Impact Ohio post-election conference, Senate President Tom Niehaus told more than 700 attendees that he didn't want to deal with anything controversial during the remainder of the state legislative session. A short 24 hours later, he indicated a deeply controversial and divisive bill that would ban abortion before a woman may even know she is pregnant is still being considered. Make no mistake, this bill would virtually end safe legal abortion in Ohio. Senator Niehaus, I want you to hear us now. Ohio values women. Ohio respects the decisions women must make, the complex personal decisions women and their families must make every day. We will not turn the clock back and turn over to politicians the personal medical decisions that belong to a woman, her family, her faith, and her doctor. But it's not enough for a politician in Columbus to tell a woman how to handle her pregnancy. Representative Lynn Watchman wants to tell a woman who her doctor can be. Tomorrow, the House committee will be voting on a dangerous bill intended to end support for preventive women's health care at Planned Parenthood health centers in Ohio. It's shocking to me, shocking and very disappointing that we're even here to fight this bill today. Politicians who want to end funding for Planned Parenthood don't seem to know what it is we do every day. They don't seem to know, or they just don't seem to care. Let me say this clearly and loud enough so you can hear me. Planned Parenthood works every day to keep women healthy and to deliver quality care no matter what. Planned Parenthood's nonprofit health centers in Ohio provide nearly 100,000 women with health care. 93% of our health services are preventive, including life-saving cancer screenings, birth control, treatment and prevention of STDs, breast health services, Pap tests, sexual health education and information at 32 health centers throughout Ohio. Planned Parenthood has been providing these core health services for over 80 years. Our work hasn't changed, but Ohio politics has. Politicians here in Columbus want to reallocate health and education funds that currently go to family planning centers like Planned Parenthood, funds that help ensure we can see every woman who walks through our doors every day, no matter what. They want to steer women's health funds away from trusted women's health care providers like Planned Parenthood and give them to healthcare organizations, some of whom do valuable work right alongside us, but don't have the capacity or the expertise to do women's health care like we do. Taking away funding that allows us to serve the most vulnerable women in the state puts politics above women's health, plain and simple. The vast majority of Planned Parenthood's patients live at or below the federal poverty level. Among women below the federal poverty level, 7 in 10 consider a women's health center like Planned Parenthood to be their primary source of health care. Ending funding for Planned Parenthood is deeply unpopular. Public polls show the overwhelming public support for Planned Parenthood delivery of health care services. Why? Because 1 in 5 women at some time in her lifetime has used a Planned Parenthood health care service. The public knows us, our community supports us, and joins us in calling on lawmakers to put aside this vendetta against Planned Parenthood and put women's health care first. Can you hear us now? Hear this. No threat to women's health care under this dome will go unanswered. Every day, our 300 staff members go to work to provide health care and education to thousands of Ohio women, men, and teens. We are dedicated to protecting access for every woman to all the health care that she needs. We will work every day to keep abortion safe and legal in Ohio. We will fight for our patients and the health care they need to get and stay healthy, no matter what. And women